Good afternoon. Welcome to the seminar, information seminar of the Master of Science in Nursing program. I am Vivian Ngai, the program leader, and we have Dr. Martin Christensen, the Associate Head of the Postgraduate Education, and Dr. Betty Zhong, the Deputy Program Leader. Now may I invite Dr. Martin Christensen to speak a few words.
Hello, everyone. Thank you for taking this time out of your, I'm sure, busy afternoon to listen to us talk about the MSc nursing program that we run here at PolyU. Now, just figuring out how to use the PowerPoint. Oh, here we go. So PolyU, as you can see here, we've been a university for quite a number of years, and the School of Nursing has had one of the first nursing master's programs in Hong Kong, and so we've been going since 1997. There you can see this this lovely picture of Hong Kong nearly 30 years ago, and PolyU when it was in its infancy. Now, what happened? What we'd like to put to you is that the PolyU nursing program, whether it's the undergraduate or postgraduate, as you're looking at in the master's program, we are very highly ranked within the world. So as you can see there, that we are 10th in the world from the QS rankings in terms of our academic reputation. And that essentially means that we have quality teachers with expertise in a number of fields that will enable you to get the best out of the subject that you want to do, or the program of study that you want to do in your master's program. We are the best in Hong Kong. We're #1 in Hong Kong for nursing education. We're second in Asia, and we're 21st in the world for schools of nursing. So you've come to a very prestigious school of nursing here at PolyU, and in Hong Kong and in Asia. Now, why study masters at PolyU? Because, as I said, we have highly skilled teaching staff that will teach you a number of different units within a number of programs that, master's pathways that we offer in our master's program. We offer you real-world learning. We offer you facilities and support services that will enable you to be successful in your studies. We also enable you to do research opportunities if you're looking to establish yourself in a research career, whether that's here in an academic capacity or in a clinical capacity. With the whole issue around COVID slowly dissipating and borders are now opening up, we are actually starting to look at study tours and exchanges with our partner institutions around the world. So there could be opportunities for some of you to be going to the mainland, if that's where you want to go, or even to the US or UK or Australia if you're looking at doing some study tours or exchanges to those countries. Now, of course, you probably won't know this, but you can see there that a number of our academics are rated as the world's most cited scientists for their research work and their teaching and learning acumen. So we have some very, very talented teachers that will be teaching you in the master's program, especially some of those around the core units that you need to take first off. Now, the program senior team there you can see is Vivian to my left has introduced herself as the program leader, and Betty to my right is the deputy program leader, and they are the two principal people within this program. So if you have any concerns about where you need to go, or you're looking at ways of establishing your career path in your master's program, these two here are the minds of information. You also have your tutorial lectures. Lecturers will help you in the specific units of study, but if those doing the practicum unit will have clinical lecturers that will help you support your clinical skills while you're out there at master's level. Now, one word of advice: if you're struggling because you've got too much going on in your life, whether that's personal or professional, I want you to consider to withdraw some of those from some of those units if you're feeling that you're getting overworked, to avoid fails and therefore to reduce your workload. So I just want you to be mindful of that. So when we're looking at the senior program team, both Betty and Vivian here are your go-to people if you need help. I support them with their decision making so that we are an effective senior team. Now, the program structure, as you can see there are 5 core units within our program, made up. These are essential. You have to do these. These are compulsory units that you need to be able to do. And once you've completed them, you can go into one of 9 specialisms. Once you've completed those 9 specialisms, towards the end of your master's program, you get a choice of whether you want to do a dissertation, which means you can do a piece of research, or you can do a systematic review, or you can actually go out and do a clinical practicum based around your master's level advanced practice framework, because that's what we're looking at here. Once you've completed the 30 credits for your master's program, you can then apply to the appropriate Hong Kong Academy of Nursing and the individual colleges to see if you're able to get advanced and specialist practice. They will, of course, require you to do some additional work to get that qualification or that recognition. And once you have that, you can actually then apply to the Nursing Council to get advanced practice status. Now, that's a voluntary system. You don't have to sit exams. You just need to be able to provide the information to the Nursing Council. Now, there are 2 ways to do that with the Nursing Council. You either do it through the academy and get the recognition from the nursing academies and their individual colleges, or go directly to the Hong Kong Nursing Council. Our advice is get it through the academy first, and then get it through the Nursing Council. Now, there are 2 exit points for our particular master's program. You do the full 30 credits, and you exit with your Masters of Science in Nursing or Masters of Science of Nursing. Or if you did 18 credits, you can exit with a postgraduate diploma. The choice is yours, how you want to end up. Most of our students actually want to complete the full masters. We have very, very few students who exit with a postgraduate, but sometimes people, they get overwhelmed with the amount of work that they have to do, so they just step off the program and then will exit with a postgraduate diploma. Now, as I said, the master's program here at PolyU is probably one of the oldest in Hong Kong. We've been going a very long time. As I said, we have 9 areas of specialism, which we will now show you some of the specialisms that we offer here at PolyU. And so for those of you wishing to come to us, can't wait to see you in semester 1. Thank you.
So the title of our program is a Master of Science in Nursing, and the program is a mixed-mode study. The normal duration is 2 years for full-time study and 2.5 years for part-time study. The final award is either a Master of Science in Nursing or with a specialty. So now I would like to show you a very short video clip about the key feature of our program.
The School of Nursing of the Hong Kong Polytechnic University offers a Master of Nursing program where there are 9 specialties for registered nurses, eligible for both general nursing and mental health nursing graduates, to develop as advanced practice nurses or nurse leaders in the changing healthcare system. It offers overseas exchange opportunities for students to have exposure to overseas nursing system. It also offers flexible study time where students can adjust their class schedule based on personal career path and work schedule. During the study, students can choose to take practicum or dissertation. For practicum, it involves working with a clinical preceptor in students' own clinical area to carry out a clinical-based project, while dissertation involves carrying out a research-based project under our own academic staff supervision. For further details about the program and admission information, please visit our website.
number of students in our program is 319, and most of the students are graduates from the local university. We do have a few international students from the mainland China and overseas university. So the aim of the program is to offer an opportunity for registered nurse to develop the knowledge and also competence as an advanced practicing nurse and a nurse leader. So this diagram presents the conceptual framework of our program, and you can see that the inner cycle represents the three major cornerstones of our program. These include advanced practice, role development, and research, which are centered on the concept of evidence-based practice and health promotion. And these concepts are the foundation of advanced practice, which enable nurses to adopt different roles in order to improve the quality of care. So after completion of the program, we hope that the student will be able to equip with updated knowledge and skill in providing holistic care, and also to ensure effectiveness and also efficiency of the care being delivered. And the student will be able to critically analyze and evaluate their practice based on the research, and also by establishing innovative projects and make clinical decisions. So for the entry requirement, you require a bachelor degree in nursing from the local university or an equivalent overseas university, and you should currently practicing in a specialty field. So for the curriculum of our program, you need to complete 3 core subjects, including the concept of advanced nursing practice, advanced method in nursing research, and also advanced health assessment, plus the elective subject from different specialty, and also decide the option of taking the dissertation or the practicum, and finally to fulfill a total credit of 30. And this table shows the number of subjects to be completed for the fulfillment of the credit requirement. For example, if you take the dissertation, you need to complete 3 core subjects plus 4 elective subjects and the dissertation. And if you take the practicum, you need to complete also 3 core subjects plus 5 elective subjects and the practicum. So I would like to remind you, if you plan to graduate in a specialty, you must complete all those elective subjects related to that specialty, and also your practicum project or dissertation must be related to that specialty. And this table shows the suggested study pattern with dissertation. First, let us look at the teaching schedule. In PolyU, we have 3 semesters. Semester is from September to December, and semester 2 is from January to April, and the classes are conducted during the evening time from 6:30 to 9:30 p.m. for 13 weeks. We also have the summer semester, which is from May to July, and the classes are being conducted during the daytime from 9:30 a.m. to 4:30 p.m. So it's a whole day for 7 weeks. So if for the recommendation of the study pattern during the year 1, we recommend you to take 2 subjects during the semester 1 and 2 subjects in semester 2. That means you need 2 evenings per week for 1 semester if you take 2 subjects. So for the second year, we recommend you to take 1 subject plus the dissertation 1, and also semester 2, 1 more subject, and start the dissertation 2. And in the final year, 1 more elective, and then you will complete your study within 2.5 years. And if you also take subject during the summertime, that means you can complete your master degree within a shorter period, less than 2.5 years. So if you take the practicum, so this is the suggested pattern. We also recommend that during the first year, you take 2 subjects in semester 1 and 2 in semester 2. Second year, 2 elective subjects, and then start the practicum project. And second semester, one more elective, and for the final year, one more elective, and then you also can complete 30 credit in 2.5 years. Similarly, if you also take some subject during the summer term, you also can complete within a shorter period, less than 2.5 years. So our program is self-financed. So the tuition fee currently is 4,320 per credit for local student, a little bit higher for the non-local student. And the award is a Master of Science in Nursing degree or with a specialty after completion of 30 credit. Or if you have completed 18 credit and then including those 3 core subjects, you can also exit with a postgraduate diploma. And this is the pamphlet of our program. You can retrieve it from our school website, and it summarizes what we have just discussed. And one point I would like to highlight is the scholarship. We offer scholarship for overseas exchange and also conference attendance. And later on, Dr. Zhong will share more about the overseas exchange. And this page shows different specialty subjects in elective subject in different specialty. Okay. And later on, our specialty coordinator will also share more information about their specialty. And this is the subject offering pattern. And from this table, you can see that most of the core subjects are being offered every semester or every year. For the elective subject, they are being offered every alternative year. If you do not want to choose to graduate in any specialty, you have the freedom to choose all these elective subjects across different specialties. That means you can get a generic award in Master of Science in Nursing degree. And sorry for the small font size. Actually, you can download or retrieve this information from our school website, or just scan the QR code from our pamphlet. Now, I would like to pass the time to Dr. Zhong.
Hi, everyone. Actually, Dr. I have mentioned about those of the subjects that you can choose in our program. And actually, the program is quite clinical focused, and we are preparing those of the frontline nurses to have the career ladder building to the advanced practice nurse. And as what Dr. I have mentioned, our program is quite clinical oriented, and it will be invited, not just our experts in the PolyU, but we will invite those of the physician, the nurse educators from the clinical, those of the clinical experts, and as well as the professors overseas to deliver the lecture. Now, after we have telling you all the academic issues, you will be interested what will be our graduation certificate look like. Now, this is an example of the graduation certificate after you have fulfilled the 30 credits that we have mentioned just now. And you may ask one more question. Besides those of the academic issues, what are the things that I can do while I'm studying at PolyU for my Master of Nursing? Of course, we have broadened your horizon. All of us know that we have been trapped in Hong Kong because of the COVID for the past few years. Now is the time to open up, to go overseas, to learn from the others, and as well as some of the exchange with the overseas nurses and as well as the scholar. And we do have other student development as well for the overseas exchange, and as well as the scholarship that Dr. I have just mentioned for conference and the overseas placement. We are not just aiming at broadening your horizon academically, intellectually, socially, and actually it is a holistic broadening of your views about nursing. Here are some of the examples that we have been conducted in the past for the overseas exchange in Sweden, in UK, in Australia, and now we have some of the explorations with the countries in Asia, for example, Singapore, to have the overseas exchange. You may ask, what are we going to do in the overseas exchange? Here is the objective that we set for you guys if you are interested to have the exchange with the overseas nurses and as well as the nursing scholar. We will have quite a practical oriented objectives, from assessment in the clinical specialty to how are you going to implement your skills and what are the difference between different culture in implementing those of the skills and preparing you the career ladder to build up yourself as an APN. In the past, we do have the trips to overseas. We will have the objective to learning together, and now it is the time to meet them face to face and also have the opportunity to have the online classroom as well. As I've mentioned, not just the professors locally in Hong Kong or in mainland, but in the West, for example, Germany as well. Here are the photos that we have taken while the exchange with the University of London students with our own local MSc students. It seems they are quite engaged and as well as mixed together during the learning activities. They are from the Yale of the US. Besides those of the, as Dr. Martin Christensen mentioned about, we have the clinical teachers and as well as the academic teachers. We do have some hardware to support you guys. As we have mentioned, you will have the research. We will offer some of the software, doing some quantitative research such as the SBS. And we understand if you are studying part-time, you may be working full-time. And there will be regular meeting with the Dr. I and as well as myself and other academic advisor in case you have any questions or issue while you are studying here. And lots of other activities to have the sense of belonging at PolyU, the information seminars, the student orientation, and as well as some of the social gatherings that we can meet with the students and let us know what are your issues of concern and what are the areas that we can improve so as to fit your learning needs. And the last, we have to know about how to apply it. Here's the link that you can find at our PolyU website. And next slide, you have to remember there are 4 things that you have to get in order to apply to our program. First of all, I believe all of you will have the certificate of registration with the local nursing council, the current practicing search, and in your undergraduate study, we need to have your academic transcripts, and there will be some other recommendation letters or certificates while you have to submit through the during the application. Now, if the slide that you can't click on the URL, the most convenient way that you will be going to our PolyU website. There will be as highlighted there, click the admission, and then you will come up to this screen because we are the taught postgraduate study. Click in the taught postgraduate study, and then remember, for this program, it is for those of the mixed mode. There are 2 Master of Nursing here. The one that we are telling you the information, it is the mixed mode. Either the part-time or the full-time for the overseas students that Dr. I have just mentioned. So if you would like to apply to our program that we have shared with you just now, click the mixed mode for the application. Remember the important dates. The closing dates for applications is April this year, the 30th of this year. Actually, Dr. I and myself are now screening all those applications before we conduct this online seminar. The announcement of the result, after we have screened all those results, we will very quickly, we will screen all those results to let you know your positions or what are the things that we can guide you. The registration will be in late April to August, and we will have an orientation while you are being accepted our offer. And if you can remember what we have said just now, and we will have another orientation to you so as to be clear about what is going on. Registration is done by online, and tentatively, if you are really admitted and accept our offer, we will meeting with each other on the 4th of September this year. And further information, it will be provided in the academic registry and the inquiry counter, and as well as the telephone hotline that you can reach us. Now, you will be interested because you are preparing yourself to be the APN, either in Hong Kong or in global. Meanwhile, I'm going to introduce the 9 specialties that we have in our program. And these are the 9 specialties that you can think of: cancer and palliative care, community health, critical care, the gerontology, because our population in the world is aging, infectious disease and infectious control, which will be related to our COVID that we have experienced in the past 3 years, the maternity, mental health is very important, and as well as the nursing education and traditional Chinese medicine. You all know that we are going to have a Chinese medicinal hospital in 2025. That's why it will be a very hot topic or specialty that you may be interested. Now, I'm going to introduce those of the specialty one by one. I myself will going to speak about the cancer and palliative care because I am the specialty coordinator of this cancer and palliative care. As Dr. I have just mentioned, on top of those of the core subject, if you are going to apply for graduation with a specialty under cancer and palliative care, you have to study these 3 subjects. You must study these 3 subjects: pain and symptom management, palliative and end-of-life care, and as well as the cancer nursing. After you have studied all these 3 subjects and the core subject, you can either choose the clinical practicum or the dissertation, more research focused, as what Dr. I have mentioned. The clinical practicum will be related to the practice gap at your workplace, and it will be different focus when you are comparing to that of the dissertation. Just bear in mind, if you are working in the palliative care ward or the cancer ward, the oncology ward, this specialty may be related to you. And next one, I'm going to introduce Dr. Dare, the specialty coordinator of community health nursing, and maybe we can have more information for Dr.
Okay, everyone. Good afternoon. I'm Dr. Grace Xie, the community nursing specialty, community health nursing specialty coordinator. Here you can see there are 3 subjects for this specialty, include the SN5835, SN5836, and the SN5037. The last one, working with young people and their families to improve mental health. Actually, this is joint subjects with another specialty. And here are our teaching team. For each subject, for the health promotion in the community, Professor Alice Law, Dr. King, and me, I will give the will teach the subject. And for community-based nursing intervention, Dr. Wah and Dr. Winston are the lecturers. And for the SN5037, Dr. Grace Hall and Miss Ode Tai are the teachers. This is this table summarizes some major information of the 3 subjects. For the health promotion in the community, the major objectives are to use epidemiological data and relevant assessment approaches to identify health needs in a target community and enhance the professional competence to practice health education and promotion programs. For this subject, there are 2 teaching models. One is lecture, another is seminar. In total, 39 hours lecture and seminars. And the assessment methods include group presentation, accounts for 40%, and individual written assignment, it accounts for 60%. And for you can see the information for the other 2 subjects here. Usually for each subject, the total teaching hours, lectures plus seminars plus tutorials for each subject, usually it is 39 hours. The assessment method, okay, for the other 2 subjects, you can see here, group project, individual written assignment, and for the SN 50737 is case discussion and reflection essay. And please be reminded to pay attention for the teaching schedule for this specialty. In the coming semester, next year, yeah, in the next academic year, this specialty will be delivered in semester 2. Okay. So please check the schedule and select the corresponding subjects according to your study plan. Okay, so this is a very brief introduction of our specialty, and welcome to apply for the specialty for our community health nursing. Thank you.
Thank you, Dr. J. As you may know, all those specialties that offered in our program are the hot thing in Hong Kong. The first one is the cancer and palliative care, and then the government is having the primary health, and the community health nursing group may be your choice. And then the next one, it will be the critical care. May I introduce Mr. Timothy Lai to share with you about his specialty.
Thank you, Betty. Hope you can see the PowerPoint.
Yes.
Welcome, students. I'm Timothy. We're talking about the critical care specialties. It's a brief introduction in our program. As I think Betty and Vivian already mentioned about the specialty requirements, you need to take core subjects and then the specialty subjects and also the completion of dissertations or clinical practicums. For critical care, we include 3 specialty subjects. That is trauma and disaster life support and 2 critical care nursing in different systems. One is cardiovascular and respiratory, another one is renal and neurologies. And I briefly introduced 3 subjects. For first one, SN 5113, trauma and disaster life support. It mainly is talking about different kinds of trauma life support skills, and the teaching colleagues, and also we invite the external guests who are experienced in trauma life support and teaching the licensed trauma care for the students. And these subjects is also welcome other students who do not want to critical care specialties, but they take as an elective, and it is very attractive and welcome to all students. Another 2 subjects is focusing on critical care nursings. The first one is for SN 5200. It mainly will talking about cardiovascular and respiratory systems disease, and also care on critical care situations. We will talking about updated informations and also technologies such as use of ECMO and also other critical care nursing techniques for this group of patients. Another one is renal and neurologies. And these subjects, we also invite the external guests from clinical areas such as the nursing consultants and also other physicians to talking about the renal and neurology care in critical care perspective. For the practicum and dissertations, it mainly will focusing on the critical care topics. Here is some examples. I won't go detail, but you can have a look. Recently, we also have some students taking dissertations. They will focusing on reviewing the literatures or design a clinical protocols for the patients with critical care areas. Some students who are not working in critical care but also want to complete this specialty, such as the students who work in A&E or other, even in general ward, they also need to focusing on the critical care situations like the patients with ventilator support or other critical situations like hemodialysis, etc. So not only students work in critical care units, but also in other units that if they want to achieve the specialty requirements, their topics, no matter on practicum or dissertations, must also relate to critical care. When you're taking the advanced practicum subjects or dissertations, the supervisors will talk with you how to achieve the specialty requirements. And you are also welcome to contact me in future if you want to take a critical care specialty. This is the offering patterns for the 3 specialty subjects arrangements. So you can see in next year, we will offer the trauma life support and also 2 critical care. Usually students can complete all these 3 elective in whole 1 year. In 2 years, sorry. Okay, so that is my briefing. Thank you.
Thanks, Tim. And now the 4th specialty that we are going to share with you is the gerontological nursing, because we know that the global population is aging. May I now have Dr. Daphne Zhang to introduce her specialty. Daphne, please.
Good afternoon. I am Dr. Daphne Zhang, an Associate Professor, School of Nursing, PolyU. Populations around the world are aging at a faster pace than in the past, and this demographic transition will have an impact on almost all aspects of society. I believe you must have provided care and working with older people. No matter you are working in acute or long-term care settings, in hospital or in the community. Hong Kong is always proud of its population's long life expectancy, but population aging is also one of our greatest concerns. As we live longer, our healthcare demands as well as expectation for quality care come to rise. To foster healthy aging, we have a mission to nurture our nurses to be an enabler through education and a range of experience. First of all, I would like to introduce our teaching team to you. As informed, I'm Daphne Zhang, Specialty Coordinator. I will take part in teaching all 3 gerontological nursing subjects. Patrick, Lily, and San will work with me and provide the teaching to all 3 subjects. To keep our teaching up to date, we have invited more than 10 guest speakers to share their experience in the 3 gerontological nursing subjects. These subjects are care of older persons with cognitive impairment, care of older people in acute care setting, long-term care for elderly people. The guest speakers are nursing consultant of a regional acute hospital, a solicitor sharing with us the legal aspects in advance directive, a physician sharing about end-of-life aspects, a charity foundation funder sharing their visions for initiating pioneer service to support older adults, a psychologist talking about bereavement, an infection control scholar sharing about COVID and residential care home management, a NGO chief officer talking about care model, a policy maker talk about establishing carer-friendly policy, and an Australian researcher talking about pain management. There are more and more other renowned speakers. This is our subject opening schedule for your reference. For more details, please check it out from our website or other related documents. Any queries, please feel free to contact me. Here is my email address. Thank you.
Okay, so I'm the specialty coordinator for the maternity. We also have 3 elective subjects, including the social context and trends of childbearing. Second is the advanced maternal and neonatal care. And the last one is the management of maternal and neonatal complication. Actually, we cover a variety of the topics, such as sexual health and also adolescent pregnancy, infertility, perinatal mental health, normal birth, midwifery, and breastfeeding clinic. We also focus on high-risk pregnancy, such as the hypertensive disorder, gestational diabetes and obesity, antenatal and postnatal hemorrhage, sepsis, management of obstetric emergency, and also maternal critical care. For the neonatal complication, we focus on prematurity, birth injury, sepsis, hypoglycemia, and congenital heart disease. Now we can move on to the next specialty. So next one is the mental health nursing. May I invite, we have a video clip from Dr. Grace Ho.
I am Grace Ho, and I am the Specialty Stream Coordinator for Mental Health Nursing. And our specialism is geared towards preparing advanced practice nurses to work with clients with mental health care needs. And an important note is that you're not required to be registered as a psychiatric nurse. And instead, if you are routinely coming across clients and interfacing with clients who have mental health care needs, then this specialism would be suitable for you. And importantly, we just have to make sure that your dissertation or practicum project has a clear mental health focus. So here is the general study pattern for the different specialty subjects, and there are 3. And importantly, I just want to note that for working with younger people and their families to improve mental health, this is the only specialty subject where it spans across both mental health nursing and community health nursing specialisms. So a great place for students with different expertise and backgrounds to come together to learn about mental health for younger people. So just a couple highlights about each of the specialty subjects. For working with younger people and their families to improve mental health, we really want to focus in on supporting and learning about the roles of nurses in how we can act upon and improve the mental health of youths and families across settings. For recovery-focused counseling skills for severe mental illness, this is a more hands-on and skills-based subject where you'll be performing assessments and case conceptualizations, and we'll also do some life lessons based on simulated situations. And finally, for advanced medication management, certainly learn about psychopharmacological principles, but most importantly, hone in on our skills in medication management and adherence for this very challenging patient population. So we will really welcome you to our specialism, and if you have any questions about this, please feel free to contact me, and here's my contact information. Thank you very much.
Now we move on to the nursing education. We will share with you a video clip from Dr. Arcus Wong.
Hello, welcome everyone. My name is Arcus, and I'm the Education Practicum Coordinator. If you want to graduate in education specialty, you will have to listen carefully to what I say here. Basically, there are 2 nursing education subjects: SN 5120 Curriculum Development and Evaluation in Nursing, and SN 5122 innovations in learning and teaching for healthcare education. SN 5120 aims to facilitate students who want to become a nurse educator in the future to develop competence in developing, implementing, and evaluating a selected curriculum. So what kind of curriculum? Maybe you have heard some of this already. For example, problem-based learning, outcome-based learning, community-based learning, and interprofessional learning. If you register this course, you have to complete 2 tasks. One is individual assignment, and another one is group presentation. Similar to this subject, SN 5122 is also another interesting subject since it aims to equip students with knowledge of contemporary learning and teaching methodologies. The content of this subject include blended learning, flipped classroom, use of some games in the lecture, storytelling, or even the latest hybrid mode. If you want to graduate as a nurse education specialty, these 2 courses will be your choices. But remember, providing only education program in your clinical project may not be able to graduate as a nurse educator. You must include nurse education theories. You have to integrate some innovative teaching methodologies into your program. If you have any questions, especially related to nurse education curriculum, of course, you can feel free to email me, and I'm Artis. Thank you.
The last specialty that we are going to introduce to you is the traditional Chinese medicinal nursing. And I think Dr. Young is here. May I invite Dr. Young to share?
Okay, good afternoon, everyone. My name is Jerry. I'm the coordinator of the TCM specialties. And as you may heard of that, the Hong Kong first TCM hospital will come into service in 2025. And for that TCM hospital, they need nurse with some background and some knowledge in Chinese medicines. And our school has been providing Chinese medicine course for our undergraduate, and we have also some advanced course in TCM for the master students. And here's the news of the TCM hospital, and they need about 300 to 400 TCM nurse. And our specialties has 3 core subjects. The first one is the nutritional approach, which is about the dietary of the knowledge in dietary in both the Western and the East TCM view, to explain why the foods work and good for the patients. And the second subject is the meridian therapy in Chinese medicinal nursing, that include not only the acupuncture, but also related therapy, including the acupressure, the motion, the cupping, and we will demonstrate you how to perform these interventions and as a roles of nurse, and how do you handle the major adverse event of these therapies and prevent the adverse event. And the final one is the advanced nursing therapeutic in Chinese medicine, which is an advanced course in the Chinese medicine nursing, which we will go through some common internal common disease in internal medicine, and also other specialties such as ONG and some common women and male problems. And finally, I would like to highlight that all subjects are taught in English, but actually not as difficult as you think. Okay, sometimes actually use English to teach Chinese medicine actually easier to understand when compared with some Asian Chinese. Okay, that's all for my sharing, and I hope you will see you again in this course.
Thank you, Dr. Young. Lastly, may I invite Professor Angela Leung to talk to you, introduce the dissertation part for this course. Professor Leung, please.
Hello, let me share the screen. Okay, I suppose you guys can read the screen right now. And okay, so I am Angela from the School of Nursing. I'm responsible for research in the school and also the dissertation in the school. Actually, I think this dissertation would be something that you could consider while you are studying your master degree. The only reason is that dissertation, I always say, is a very first taste of research, and that may make you consider to move on to study PhD as well in the future. So if you have the courage, then I really hope that you can try to consider this dissertation. We have some prerequisite for joining the dissertation. Students should be, most of the students actually joining the dissertations are the very good students, and they have 3 good results in the completed courses. At least they have to got 3 Bs in the courses that they have taken, and there's a requirement for them is that one of the course must be a research methodology. And we hope that the students also got a good grade in the GPA, so at least a GPA 3 or above. Then with, if you meet all these requirements, you are welcome to enroll into the dissertation. If you consider a specialty in the master program, a specific specialty, then probably you would like to continue with this idea for your dissertation as well. So for example, if you decided to go for critical care, then your dissertation should be related to critical care as well. So this dissertation is divided into 2 parts. One is the dissertation 1 that lasts for 1 semester. I'm sorry, I didn't post up this one. Yeah, the first semester is for doing the dissertation 1, and it has 3 credits, and the dissertation 2 actually lasts for 2 semesters, and this longer course actually allowed you sufficient time to work on your data collection, data analysis, and write up the whole dissertation. To ensure that you are able to complete the whole dissertation, we have some criteria. Is that for the dissertation 1, you have to attain at least a grade C plus or above before you move on to the dissertation 2. And in the dissertation 2, basically at the end of the day, you have to submit a dissertation. And in many occasions, teachers and students would like to submit a manuscript to the peer review journal as well, and that is also acceptable if you do that. So for the dissertation 1, basically, as we mentioned, it is a 1 semester course, and so that is the efforts that you make by attending the seminars. So each week we will have seminars for you, and you are able to present your ideas as well as learning from the peers that how did they work out the research ideas. And you should be able to meet your supervisors individually by yourself at the time that is convenient between you and the supervisor. And you should have some time to work on the independent study. So each one of you will be assigned with a supervisor who is a very experienced researchers, and you would learn from the teachers that how to work out the research ideas as well as how to work out the dissertation. As I mentioned, that you have to attend the weekly seminar that runs throughout the whole semester. And at the end of the dissertation 1, that means after 1 semester, you should be able to submit a proposal. And this written proposal, we call it a dissertation 1, and that would be graded by 2 teachers. Then if you move on, then you will go for the 2 semester dissertation 2, and similarly, you have to attend the seminar, meet your supervisors regularly, and work out the whole dissertations, and it would take about 350 hours as total in the 1 whole year. And the most important is that you may be considered to go for data collection, learn how to do some simple data analysis, and at the same time share the findings with your peers and teachers in the seminars, and submit the dissertation at the end of the 3rd semester. So you can see this is a summary for the dissertation 1. All you need to do is to submit the proposal, and then in the dissertation 2, We give you some scores for attending the seminars because you have some presentation in the seminars. And the dissertation one, we don't give score to you because that one you will present your ideas only without any data. So we don't give score for you in the dissertation one for the seminars. And yet, I think it is very valuable to learn from each other. For the dissertation, that will be assessed by the teachers, and that would wait for 80% of the total score in the dissertation too. So consider to join this dissertation. I'm sure that you will be very proud of yourself after completing the dissertation. Last semester, we have a very large number of students to join the dissertation, and they really enjoy the interactions in the seminars every week, and they look forward to meet each other and talk about their research and share their ideas and argue and bargain. And I think this is a lot of fun in the seminars. So once in a lifetime, think about doing the research under the supervisions of our very experienced researchers. So that's what I want to share with you, and I
Thank you,
welcome
Professor Lan.
comments.
And if you would like to graduate with a specialism award, you may either choose a dissertation that introduced by Professor Lang just now, or the clinical practicum. Now I hand over to Dr. Ai introducing the clinical practicum.
For the clinical practicum, you need to identify a practice gap in your workplace and also develop a practicum project to address the practice gap. And you will need to find a preceptor in your workplace, preferably a fellow or experienced nurse who could support you in the design and implementation of the project. The supervisor from the PolyU School of Nursing will also provide the guidance and lead you to the development of an evidence-based program.
You may dial the either the hotline or our general office telephone number, get connected with either Dr. Ai or myself, Betty. We can answer your questions, and if you have any other concern. Thank you for joining us this afternoon for the information seminar, and goodbye.